Do you know what are the most common diseases that can affect your beloved canine friend? One of the most common diseases in dogs is canine parvovirus, a highly infectious virus that can be fatal. This virus is known to be particularly aggressive, and it's not something to be taken lightly. Canine parvovirus, often referred to as parvo, is a highly contagious disease that primarily affects puppies, although dogs of any age can contract the virus. It's a ruthless adversary, targeting the dog's intestinal tract and sometimes even the heart. The consequences can be severe, with symptoms manifesting as vomiting, bloody diarrhea, and severe weight loss. What makes parvo so dangerous is its high rate of contagion. The virus can be picked up from contaminated soil, feces, or even from the fur or paws of an infected dog. And once a dog is infected, the virus works rapidly, often leading to severe illness or even death. Diagnosing parvo is typically done through fecal tests. Veterinarians will look for the presence of the virus in the dog's feces. It's crucial to get your dog to the vet at the first sign of illness because, as we've mentioned, parvo moves quickly and time really is of the essence. Once a diagnosis is made, treatment usually involves hospitalization. Because parvo is a virus, there's no cure per se. Instead, treatment focuses on supportive care to help the dog's body fight off the virus. This might include intravenous fluids to combat dehydration, medication to control vomiting and diarrhea, and antibiotics to ward off secondary bacterial infections. But here's the good news. Canine parvovirus is preventable. Regular vaccination is the most effective way to protect your dog from this deadly virus. Puppies should receive their first vaccine around 6 to 8 weeks of age, followed by a series of boosters every 3 to 4 weeks until they're about 16 weeks old. Adult dogs should be kept up to date with regular booster shots as well. Remember, prevention is better than cure, so ensure your dog gets vaccinated against parvovirus. It's a small step that can make a big difference, keeping your furry friend safe and healthy. Another common disease in dogs is heartworm disease, a serious and potentially fatal condition. Heartworms are parasitic roundworms that can cause severe lung disease, heart failure, organ damage, and potentially death in our beloved canine companions. What makes heartworm disease particularly insidious is how it stealthily creeps up on its victims. The disease is transmitted by mosquitoes, turning a seemingly harmless insect bite into a silent and deadly threat. Once a dog is bitten by an infected mosquito, it can take up to 6 months for heartworm larvae to mature into adults and start causing symptoms. The early stages of the disease may not present any symptoms at all, but as the disease progresses and more heartworms accumulate in the heart and lungs, symptoms start to appear. Dogs may experience fatigue, especially after exercise. They may lose weight and become lethargic. Coughing is another common symptom, which can lead to severe complications like difficulty breathing and fainting. In advanced stages, dogs may suffer from heart failure and a swollen belly due to excess fluid in the abdomen. Diagnosing heartworm disease involves blood tests. Veterinarians look for specific proteins called antigens, produced by adult female heartworms in the dog's blood. Additional tests may include X-rays and ultrasounds to evaluate the severity of the disease. The treatment of heartworm disease can be complex and costly. It involves medications to kill adult heartworms and their larvae. But in severe cases, surgical removal of the worms might be necessary. It's important to note that treatment can cause serious complications and should be overseen by a veterinarian. Prevention is by far the best defense against heartworm disease. Heartworm preventatives come in various forms, including oral tablets, topical liquids, and injectable products. These medications are typically administered monthly and are designed to kill heartworm larvae before they mature into adults. Protect your dog from heartworm disease by using heartworm preventatives and regular vet checkups. Remember, it's not just about treating heartworm disease, it's about preventing it in the first place. After all, our dogs depend on us to keep them safe and healthy. Lyme disease, transmitted by ticks, is another common disease affecting dogs. It's a bacterial illness that can cause a variety of health problems in our canine friends, and it's one that no pet owner wants to hear their dog has contracted. So, what exactly is Lyme disease? It's caused by the bacterium Borrelia burgdorferi, which is transmitted to dogs through the bite of an infected tick. These tiny creatures latch onto the skin of our pets and, if they're carrying the bacteria, can transfer it to the dog's bloodstream. Now let's talk about the symptoms. Lyme disease can present in a variety of ways, but there are some common signs that pet owners should be on the lookout for. These include fever, loss of appetite, and lameness. particularly recurring lameness that appears to shift from one leg to another. Dogs may also experience swollen joints and may be lethargic or depressed. It's important to remember that these symptoms can take 2 to 5 months to appear after the tick bite, so even if your dog seems fine now, they could still be at risk if they've been exposed to ticks. Diagnosing Lyme disease typically involves blood tests to detect antibodies to the bacteria. If the test comes back positive, your vet will likely prescribe a course of antibiotics to combat the infection. But here's the good news. Lyme disease is preventable. Prevention strategies mainly focus on tick control. Regularly check your dog for ticks, especially after they've been outdoors in wooded or grassy areas. There are also a variety of tick control products on the market, from collars to topical treatments, that can help keep these pests at bay. And let's not forget about vaccines. While not 100% effective, they can still significantly reduce the risk of Lyme disease in dogs. While Lyme disease can be a scary diagnosis, it's important to remember that with early detection and treatment, most dogs recover well. Keep your dog tick-free to prevent Lyme disease and ensure a healthy life for your pet. Last but not least, canine distemper, a viral disease, can also pose a threat to your dog's health. Our focus now shifts to canine distemper, a highly contagious and potentially lethal virus that primarily affects puppies and young dogs. Despite being less common than some other canine diseases, it's a serious condition that no dog owner should overlook. Canine distemper is caused by the distemper virus, which is spread through direct contact with an infected dog or by airborne exposure. The virus first attacks a dog's lymph nodes before moving to the respiratory and nervous systems. The early signs of canine distemper can be subtle, but escalate over time. Initial symptoms often mimic those of a common cold, a high fever, nasal discharge, and persistent coughing. As the disease progresses, it can lead to more severe symptoms like vomiting, diarrhea, and in advanced stages, seizures and paralysis. Diagnosing canine distemper isn't always straightforward. The virus can be challenging to detect in its early stages, and symptoms can be easily confused with other conditions. Veterinarians typically rely on a combination of physical examination, medical history, and specific blood tests to confirm a diagnosis. The truth is, there's no specific cure for canine distemper. Treatment involves managing symptoms and supporting the dog's immune system to fight off the virus. This might include hospitalization, intravenous fluids, antibiotics to prevent secondary infections, and medications to control seizures and other neurological symptoms. Now let's talk about prevention. The good news is that canine distemper is preventable through vaccination. Puppies should receive their first distemper shot between 6 and 8 weeks of age, followed by a series of boosters. Adult dogs should be kept up to date with their vaccinations too. Remember, the best defense against canine distemper is a good offense. Regular vet checkups, a healthy diet, and keeping your dog's vaccinations up to date are crucial in keeping them safe from this disease. Vaccination is the key to protect your dog from canine distemper. In conclusion, being aware of these common diseases can go a long way in caring for your canine companion. We've explored some of the most prevalent afflictions that can impact our four-legged friends, including canine parvovirus, heartworm disease, Lyme disease, and canine distemper. Each of these diseases carries its own set of symptoms, diagnostic methods, treatments, and most importantly, preventive measures. Regular vet checkups are a must. They can help in the early detection of these diseases, giving your pet the best chance at a full recovery. Vaccinations too play a crucial role. They can prevent many of these diseases from taking hold in the first place. And let's not forget about the simple measures we can take at home, like maintaining a clean environment and providing a balanced diet. In the end, it all comes down to being an informed and proactive pet parent. Remember, a healthy dog is a happy dog. So keep your furry friends safe and sound. Thanks for tuning in.